Good morning. Thank you for the opportunity to present our work here. As you can see, we have no conflicts of interest to declare. I want to talk to you again. I was very grateful for the first talk of this session about the Wnt pathway in Dupuytren disease, and I want to show you some of our data on that, which were based mostly, we started out from the genetic studies which have been referred to previously, which have been published from here and other groups. And the Wnt pathway was one of the pathways which was found to be dysregulated, or at least there were mutations in an astonishing number of Wnt-related genes. Also, as has been shown before, beta-catenin expression is increased, but also there have been some other data which were a bit less clear. So there was no correlation to recurrence of Dupuytren disease with the expression of beta-catenin, not that much correlation between the expression of the genes coding for the Wnt proteins themselves and beta-catenin dysregulation. So what we decided to do is to look at more levels of the Wnt pathway, so also the receptors, several downstream mediators, and in all we checked 84 genes, and we compared from 12 patients nodules and matched controls, so unaffected fascia. And a preliminary result, which you can see here, is that an unsupervised cluster analysis was really nicely able to distinguish between nodule and control tissue, indicating that there were real differences there. So diving further into these results, we could confirm that there is no one Wnt gene of the activators that can really be associated with, that's really highly and significantly upregulated. Wnt7b, which was also in the GWAS, is upregulated but highly variable, so not significant. Furthermore, in the genes that were upregulated, we found some components of the non-canonical Wnt pathway, which we could also verify their upregulation protein level. I won't show you the data here due to time. We also found, as has been shown before, the high upregulation of WIS1 in tissue. I'll go into that in a minute. And we found among the, that is the wrong button. I don't know. Yes. This helps. Let me see. Yes, this works. We found among the highly downregulated genes, we found 4 which are all endogenous antagonists of Wnt signaling. So that was also very interesting. And I want to go into those last 2 points a bit more in detail. First, WIS1, which you can see was also highly upregulated on a protein level. This is representative pictures of control and nodule tissue, and the graph depicts the expression levels in 10 patients. So it's fairly consistent. Then we started looking into this a bit further. I appreciate the remarks made by the previous 2 speakers about cell culture, but it is the system we used here just as a first experiment. And what we did is to knock down WIS1, and you can see here that that worked well. We used siRNA. We had a good knockdown both at mRNA and protein level compared to a control. However, this did not affect the fibrotic markers. These are cells, by the way, isolated from nodules, so they are actual Dupuytren's fibroblasts. And as you can see here, there was no change in ACTA2, which codes for alpha-SMA, and even an upregulation in collagen 3. And on protein level, there was no difference yet. There was no difference overall in the expression of SM22 alpha, which is also a fibrotic marker. So although there is a clear upregulation, we were not able in vitro to show a functional role for WIS1 in this setting. So it might just be a marker. It might be the system that we used. As to the endogenous antagonists, this is just the graphs representing what I showed you earlier in the table. So you can see there's really a strong downregulation. And interestingly, that downregulation could be mimicked in normal fibroblasts this time by the addition of TGF-beta1, which is also a pro-fibrotic compound, as you know, and is present in Dupuytren's tissue. And there seems to be a bit of a crosstalk here between the Wnt pathway and TGF-beta1. We tried to look further into that. We looked at the expression of beta-catenin in fibroblasts, which were stimulated with a very low dose of TGF-beta. And when we did that in normal fibroblast, I hope you can see here down, there is no nuclear expression of beta-catenin. It's present in the rest of the cell, but there's no nuclear expression. However, when we used siRNAs to knock down these 4 antagonists, you see that suddenly the same dose of TGF-beta can cause nuclear expression of beta-catenin, indicating that the knockdown of these antagonists, which is in itself mediated by TGF-beta, then makes the cells more prone to beta-catenin and to Wnt signaling. So in summary, I want to hope that I showed you that there are many levels of Wnt signaling that are dysregulated in Dupuytren disease, and that there's also a strong case for there being crosstalk between the different pro-fibrotic pathways. And then I want to acknowledge the help of Evert-Jan ten Dam and of Professor Ruud Bank, Professor Werker, and also the patients who allowed us to use their tissue and their data in this study. Thank you.